So thanks again very much for joining us today. I'm Saeed. I'm one of the co-hosts of the DIEP End podcast, joined by my co-host Hank.
Thanks for joining us, Dr. Rodriguez. We're really excited.
Welcome. Good to be here with you guys. Thanks for the invitation.
Of course, yeah. Just sort of a background to all of this. I remember when I was at the NIH as a general surgery resident at Hopkins, when I got word that you were going off to NYU, I made it a point to come and meet with you at shock trauma just before you were to take off. And I remember meeting with you. You were a huge inspiration to me, and you said, "Let me mentor you." And it was, I think, 1 or 2 weeks before you took off. And it just reminds me, somebody like you, somebody like Dr. Levin, who always makes time for their mentees. We're forever grateful for that. So I really, really do appreciate it.
Well, it's my pleasure, and it's wonderful to see how far you have come and great success. So a tribute to you, your hard work and commitment.
Thank you so much. One of the things that Hank and I are always interested by when talking with our guests is, you have such a grand career and trajectory and everything that you've done. Again, inspiration to all across all fractions of plastic surgery. What do you think, looking back as a kid, your upbringing, your family, are there any particular factors that you think influenced where you are now, like your parents, your upbringing, et cetera, that molded you into who you are today?
Absolutely. My parents deserve a lot of the credit, and being coming from an immigrant family, my family came from Cuba in the early 60s, and they ended up having four boys. And the ultimate goal was to kind of provide their kids every opportunity to get the best education possible to live the American dream. And it was very important for my parents to instill in us that education was the key to success. Although we were very much involved in sports and a lot of activities, which was kind of a way for my parents to keep us out of trouble. Family values played a huge role. In our upbringing. Faith
Mhm.
played a huge role, and of course, this pursuit of education as a way to kind of rise above and get out of the circumstances that we lived in. So there's no doubt about it that my parents deserve all the credit
Yeah.
for giving us that foundation.
Any of your siblings go off into medicine?
No, I'm the only one.
Mhm.
My older brother's an attorney. I'm number two. Number three and number four are business people, work for big companies, but I'm the only physician.
So what would you say growing up, aside from school and education, what was your like favorite sport, or what was the other thing that you did growing up?
I think anything with my brothers, whether it was playing sports with them or riding bicycles or with our friends, it was kind of group things. So I guess we can call it team dynamics, whether it's with brothers or friends, and it could be playing sports or going to the beach together, whatever it was. Um, any team like more than one person activity is something that I favor, and that's why for me academic medicine is a great fit. I could never be a sole practitioner. So I think being around people, caring for each other, and then building each other, whether it's me throwing the pass so that my brother can score a touchdown or, whatever it was, it's all that. It's kind of we're all celebrating each other to achieve success. And there's always some inherent competition,
Oh yeah.
but no one can score unless if someone passes you the ball. So that was kind of a overarching theme within all of us and my friends and my brothers and my cousins. So it was a kind of a close knit unit.
Um, One of the other things we like to discuss with our guests is kind of their pathway into medicine and into plastic surgery. And you, of course, have a very unique pathway. You got your DDS, your OMFS trained, and then plastic surgery and microsurgery abroad. Can you talk a little bit about how that came about?
Sure. Listen, I wish I could tell you it was a clear line, but when I was in college, I was interested in medicine. So I was actually pre-med. And dentistry had been in the back of my mind because one of my close friends' father was a dentist, and he was a wonderful guy. And I always tell people, I think often we want to emulate people that we'd like to be like. So my friend's father was a dentist, and then I had an uncle that was a physician. So both of those were kind of very interesting to me, and I was able to shadow them and spend time with them. Unfortunately, I applied to medical school, did not get in. So dental school was kind of the next best thing. And I pursued that. I didn't really know what I was going to do in dentistry, but dentistry was a kind of a good fit for me because it was a fun time. It was good school. I went to NYU and I did well in school. I just didn't know what I wanted to do. I thought I was just going to be a dentist. But when you go to dental school, you realize that there are a number of specialties, no different than when you go in the medical field. And one of my close friends' father was an orthodontist. So I thought, wow, orthodontist, that could be a cool field. And he was such a great guy. He told me there's not going to be enough in this for you. You need to pursue, you need to be a surgeon. So oral surgery was kind of the appropriate pursuit. And then I did my residency in oral surgery up in New York. And this gives me the opportunity to thank the people that I've met along the way. I've had, I would say, three of the most powerful mentors. And unfortunately, one of them just recently passed, Arthur Adama, who was my mentor in oral surgery. And he always thought that I needed to pursue more than just oral surgery. And I went on to apply to medicine. Um, back in that time when I was doing oral surgery, it was kind of a new relationship where oral surgery programs were getting affiliated with medical schools and getting a medical degree. At that time, when I applied to this program, I specifically wanted nothing to do with medicine. I think that gives me the opportunity to tell you and your audience that we often want to shy away from things that we don't do good at or do well or perform
Yes.
well, or things that we may fail and we're afraid of failure. So
Mhm.
I was really frightened to even consider that. And here, lo and behold, my mentor's telling me, I think you're going to need to do more than what you're doing right now. And I guess it gives me the opportunity to say, a lot of people, as I mentioned, two other individuals as we go down the road, probably believed more in me than I believed in myself. So I applied to all schools of medicine that had an affiliation with an oral surgery program, thinking that that would be an easier way. And the goal was not to do another full 4 years of medicine because I already had a lot of debt from dental school, and then you carry that debt over into a residency. And I was fortunate that out of all these schools that I applied to, only one place gave me an interview, and that was the Medical College of Virginia in Richmond. And I remember my wife and I got married. We came back from our honeymoon in St. Croix. I packed up my Bronco and we drove to Richmond. On the way to Richmond, I saw these signs, Johns Hopkins Hospital. Oh, that's pretty cool. See what that's about, maybe on the way back. So I interviewed a number of us who were oral surgeons throughout the country were interviewing for, I believe it was a singular spot. One of the residents from MCV who was in that dual program, getting an oral surgery degree with a medical degree, decided he didn't want to go to med school. So they interviewed several of us to get that spot. And I was fortunate enough to get that position. But on the way back from Richmond to New York through Baltimore, I stopped at this hospital called Johns Hopkins Hospital,
I've
and I
heard of
walked to this area. Yeah, it's at that point I heard of it, but I didn't really know anything about it. And I walked into this place, the Dome, and I was just impressed by this place.
Yes.
So anyhow, I got accepted to medical school. I went to Richmond, um, frightened to death. Going to do, I go to, I'm do 2 years, so I jump into the second year class, and I'm dealing with all these students that are much younger than me. So I really crank it up, and I'm like, I'm going to focus on becoming a good physician, study, perform really well in school. At the same time, when everybody gets the summer off, I have to start rotations early, and I'm doing gyn-onc, which is very hard rotation in medical school at Richmond, where everybody else has time off so they can study for step one. I was in gyn-onc studying for step one because I have to graduate. I graduate with the previous year's class because I don't do the fourth year. So
Yep.
I have during the summertime I have to do all these clinical rotations, pass my step one, do well, and now at this point I'm thinking I'm going to pursue a career in plastic surgery.
Mhm.
Initially, I thought I'm just going to get a medical degree and do what all these other oral surgeons are doing, and nothing against them, but my mentors were like, listen, you've come this far, do everything like that. You'll never have to feel that you have to hide behind anything or you can't do anything. And they were right. So
Yeah.
at that point, I decided I'm going to go to the hardest general surgery training program. That's why I chose Johns Hopkins. So I applied there. I got accepted um, as a intern. Basically non-categorical, just to flee, jump in there and do it. And I worked pretty hard. Unbeknownst to me, my mentor from oral surgery, Art Adamo, wrote a letter to Paul Manson, which I did not know. And in that letter, he said, please keep an eye on this kid. He's one of the best residents I've ever trained, and I think he has great promise in the future.
That's
Paul Manson met with me. There were no positions available, but he was very supportive. And in my first year, I applied to a ton of programs. I got a lot of interviews. And I remember I had an interview coming up the following week, and Paul Manson approached me. I was going to do a general surgery procedure with one of the surgeons, and he approached me and he goes, "Do you believe in God?" I had no idea what he meant, what he was talking about. And he goes, "Well, as you saw from the show last night, Hopkins 24/7, Reese, a sergeant, one of our integrated residents, just dropped out of the program. So I'm going to interview some applicants this position to fill it." So he was very kind. He told me, cancel your flight. I'll take care of it. They interviewed me that weekend with some other individuals, and I got the spot. So I stayed in Hopkins. I finished that career. And at that point, I thought I wanted to be a craniofacial surgeon. I had an interest in cleft lip and palate and that kind of stuff. But the more I got involved with that field, I just felt that it was too small of a topography to me for me to work on. So I had an interest in microsurgery. Keep in mind, we're in 2003. The title of your podcast is the starts with DIEP, a play on words. The DIP did not even exist. The most that we would do was a muscle sparing tram. So a lot of pedicle trams and a muscle sparing free tram. During my residency, I saw one fibula. And the one thing that I realized back then is that people that were doing microsurgery, they certainly were not at ease. And there's a certain amount of tension and anxiety goes along with those procedures. So I felt this is a field that I'm interested in. I like the head and neck craniofacial component. And I had seen an individual while I was an oral surgery resident. Going back, there was a conference that a gentleman by the name of Joseph McCarthy ran with Paul Manson in New York, and they ran it at the Waldorf Astoria. And I saw this surgeon by the name of Yu Ray Chen present on an amazing case volume of patients with neurofibromatosis and all kinds of skeletal surgery. And back then I had said, wow, someday I'd love to go there. And lo and behold, now I have an interest in microsurgery. So I'm in my first year of plastic surgery, and I told Dr. Manson I'd like to visit this place, Changgung. That year, the American Association of Plastic Surgeons meeting, AAPS, had their annual meeting in Seattle. And in our first year of plastic surgery, I only did 2 years of plastic surgery in those times. I was in Seattle, and I took the opportunity to jump the pond. I jumped the Pacific, and my wife and I went to Taiwan. I interviewed with Fu Chen Wei, Yu Ray Chen, and I just got to see what this place was doing, and it was just an eye opener. The only condition was that Professor Wei told me you can only do either microsurgery or craniofacial. You can't do both. I went to do both. So I set my eyes on microsurgery. I committed. I did my time at Fujian Wei. I was supposed to go to Changgung in July of 2003, but we had this little problem in Asia called SARS. So at that point, there was an issue in the shock trauma center. Paul Manson said, listen, I need a warm body and a pulse, someone to handle trauma. So I got an automatic job in shock trauma. I started doing all these things. And then a few months later, once SARS cleared, I went to Changgung. I trained there, and then I came back, and that was kind of how it went. But the pursuit was initially to be in medicine, and look at how it worked out. But I would say my comment would be that I don't regret any the decisions that I made along the way. It ended up working out well. And the message is, you shouldn't be fearful of failure. You just got to keep your eye on the prize. It's not so much being triumphant with everything that you do. Occasionally, you have to fail in order to kind of find the pathway to success.
Yeah, I mean, you're the second person, Scott Levin, who we chatted with a few weeks ago, mentioned not getting into medical school and having to go overseas. And you both remind me a lot of each other and huge inspirations. And the same thing happened to me. And it's so nice to hear those stories because thank God you both got in because our specialty would be losing two of the biggest names in our history.
That's
So.
very kind.
But it's nice. It's also kind of interesting, and I almost thinks that something greater is behind the scenes because of how life comes full circle. You know, you start off at NYU, and now you're back at NYU, and thankful for all these mentors who kind of whisper your praises behind the scenes without you even knowing about it. It shows you how special somebody like Paul Manson and all of your other mentors are.
Absolutely.
Um, so the VCA aspect of your career, even when you're at shock trauma, really ignited. And then at New York, it's been one really triumph after another, from a face double upper extremity transplant to face and eye. What do you think? Two questions. What do you think takes the success in VCA? Like, what's going to be our future in VCA? The things that we haven't really nailed down that are important. And then what's your next project? Because there's a pattern here. You're doing things that have never been done before. So I'm curious, what do you think is the next thing to do?
Well, first thing, before I answer that question, I'll preface a couple of things. When people ask me, how do you start a face transplant program? How did I get involved? When I was in Baltimore in shock trauma, when I initially took the position left, but then I came back formally in 2004, Paul Manson asked me to assist Walter Reed and National Bethesda with injuries that were coming back from our wars in Iraq and Afghanistan. And the injuries that I saw in these soldiers was something that you kind of is somewhat comparable to self-inflicted gunshot wounds because these improvised explosive devices with this high velocity and then force of impact was horrific. And despite our best efforts to do procedures with conventional surgery, even the most sophisticated microsurgery, it really wasn't making people normal. And even if you compare Harold Gillespie's results with pedicle tube flaps, they were probably better than what we were doing with microsurgery. Maybe it's not a fair comparison, but it wasn't much more of an improvement. So at that time, I got involved in this project through the Office of Naval Research, which was titled Face Transplant for the Wounded Soldier. And it primarily started with some basic science research, some preliminary models that we worked on, and then that eventually translated to the first patient that I did, which is Richard Lee Norris,
Mhm.
which was a full face with jaws and teeth and all that. And that was a great learning exercise. But the reality is that to get there, you always have to, it comes with, you just got to load and unload freight. You're dealing with deformities where there was a shock trauma, motor vehicle collision, sports related accidents. Often I would get sent other issues, congenital defects, some oncologic deformities, secondary reconstruction. Doing all this kind of prepares you to do the face transplant. So fast forward to New York, it's not like I'm looking for a complicated case. It's certainly not ego driven, although I have an ego. I think the ego drive is when patients come to me that have horrific situations and asking for help. And I've certainly declined several patients. I think there's some patients, it's just not the right fit. It's a big risk. And what people need to realize that whenever I select a face transplant candidate, I basically tell them, I'm going to shorten your lifespan. That's 100% certain. And in these cases where other individuals haven't been successful, for example, the face and double hand, that had been attempted twice before. One patient died in Paris, and the other patient lost the limbs in Boston. So there is concern, despite our best efforts to practice. There's always that in the back of my mind. But I do feel that these are exercises that, if we're thoughtful, methodical, we can try to avoid some of the issues. And there were issues that it's not like these individuals really publish robustly about what happened, but you get an idea of how we can avoid complications. And what we did in the face and double hand was that I procured the limbs real time with real perfusion rather than just limb amputation one and one and then run to the recipient room, racing dissection, blood loss. So I controlled volume, I controlled blood replacement, blood product replacement. So we were able to do that successfully. And then with the face and the eye, that was an individual that had a horrific facial injury, and they had been communicating with us from their other hospital they were at, and it kind of interested me. What about the possibility of an eye transplant? It had never been done. It's never really been talked about. There have been attempts that were claimed as whole eye transplants, but that was retracted from the media. It wasn't accurate. But the possibility did exist. The unique element is that now we're crossing from the peripheral nervous system to the central nervous system, and we don't really know how they're going to work together. Could rejection in the eye reject the face? Keep in mind where we're dealing with connecting of an optic nerve, which is part of the central nervous system. We can get infections, we can get meningitis. A lot of things can happen. But I'm always very clear with my patients about the fact that it's never been done. I can't guarantee success. I'm going to shorten your lifespan. You could die in the operating room. So I want you to understand what it is that you're getting into. But the one thing I'm going to say about all my patients, even this last one, Aaron James, they're incredibly altruistic and they want to commit themselves to help advance science and medicine for other individuals. And that's been kind of the premise and the common theme with these individuals. So what's next? I'm fascinated just with this recent one with the eye. There are a number of things that have occurred that are very difficult to explain, but I do think I can home in on this a little bit more. There are a number of tenets that occurred that maybe were described differently, and I think I've learned that a lot throughout my life. And it's not like I want to be arrogant to challenge them, but I often question certain tenets that are defined as law where there's no true commitment or science behind it to make the claim. And therefore, I want to understand that fortunately, with this last case, a number of individuals far brighter than me have come out to reach out to us to try to work together. And how is it that we can improve the possibility of messaging the brain better? Because we did have some initial messaging to the cortical centers of vision, and then eventually they kind of dissipated. So there was something happening. An important thing is that the globe is viable, has normal retina, normal volume. So that in and of itself is a huge success. But now where do we move forward? And I often think as plastic surgeons, I think there's greater possibilities to kind of how could we cross that barrier into the central nervous system. But I think the component of the eye and how is it that we can keep this viable, maybe improve messaging. A number of high-level individuals that have certain companies that are working with central nervous system deficits and motor deficits could potentially help of how do we work on this kind of interface. But that's kind of a personal interest now that I've been involved in it, understand it a little bit more. And there are patients that we're evaluating now.
Well, I know some of your transplants are very vocal on social media and are helping to celebrate and spread the good word, especially the double upper extremity face transplant. I've been following, and he seems to be living a good quality of life, which is great.
Yeah, he's great. Sometimes I live too good, but Saeed, in these patients, the one thing that I realized, and I learned this early on, at the beginning, most patients are very compliant within their first years. And usually at year 3, things starts happening because they feel well, they've kind of missed out a lot on society and activities in their life. So they try to catch up and do things that probably expose them to a little trouble, rejection. We got to manage them. No, I'm okay, doc. Please come in. We should. And what I realized that I can't get frustrated with that anymore. It's my responsibility to give them another chance at living. They understand what the risks are. I'll always be here for them. I hope they don't put themselves in a situation that could harm them, although it does happen. But at least what we can say is that they're living their life. For example, with Joe DeMeo, he recently just got married. They were in Hawaii. He wouldn't have had that life the way he was before. He was living with his parents. His mom was feeding him.
100%.
They
Yeah.
created an attachment with a spoon and a bracelet so he can just feed himself. He had difficulty chewing because of the scarring around his mouth. His mom had to do his hygiene, bathe him, after you use the toilet. That was his life. So to
Yeah.
see an individual be on his own, whether it was him, same thing with Patrick Hardison, the firefighter, he was bound. He was living with his mom because he couldn't drive because of the apertures of his eyes. You see him now driving, his kids, his daughter got married, he's got grandchildren. You give him an opportunity at living again. But unfortunately, living, depending with the exposure, comes with consequences. But at least they're living, and I'm happy for them, which they didn't have before.
So we have two last questions just to keep you on time. One
Yeah.
thing I'm always fascinated by, especially you, is how you get everything done. And so how much sleep do you get a night?
I would say it's probably 5 hours
Mhm.
weekdays.
Do you work
Five
out?
hours. What's that?
You work out too?
I would love to work out on the weekdays. Like for example, today, so I try to ideally, I'd love to work out 3 times a week. That
Yeah.
would be my goal. Sometimes it's just two.
Yeah.
But I'll take two. And two is usually almost always Saturday and Sunday, unless I'm in Florida or it's warm here and I get invited to play golf, which is now another passion of mine that I love. But I do try to exercise, and I always exercise with my wife. We do it together.
Yeah.
I love golf. She also loves dancing. We do a lot of things together. She's very much interested in ballroom dancing, not competitive ballroom dancing, just us having fun
She has a
and
fantastic page on social media about you, and it's
oh
just
God,
it's heartwarming. It's really, really special.
she's great.
She's a number one fan, but it's the support system like that that allows us to do what we can do.
Yeah,
So Hank, you want to
yeah,
ask that last?
Yeah.
No, go ahead.
exactly. But with that, so you have to, you have to feed that. It's
Mhm.
not just one person supporting me and what I do. No, we do it together. She's a
Yeah,
great fan, but I'm also her number one fan.
of
You
course.
know, and for example, like tomorrow night's Friday, she's like, let's do a dance class. At the beginning, I was like, oh God, do I want to do a dance class? But you know what I've realized? Many things. It's like life. It's like my career. We've all been in situations that we don't want to do something, and then you do it. It's the best thing you ever did.
Yeah.
I think living life that way, and the quote that I often use, and I tell people when they ask me, you have to work at living. That doesn't mean employment work to live. You have to work at living and seize the moments. Don't shy away from them. There's plenty of time to sleep. Trust me, I like to sleep. And the weekends I rest in, but your clock is kind of set. You just get up early, but at least I get up and there's no rush. The hospital, get in a cab, got to be on time. My ID works, all this done. That's a different kind of stress. But you have to work at nurturing your life with health. Make sure you eat the right things. Make sure you exercise. Make sure you're passionate about your work. We spend more work hours doing what we do than we actually spend with our eyes open at our own home. So that time with your family, with your loved ones, live it passionately and commit to it, because time does go fast.
Mhm.
And you want to reach a point in life, and I'm a very practical man, that the day of tomorrow, when it's time for me to leave this material and spiritual world, that I have done everything that I can do, that in my mind I can say it's time to go to my eternal sleep, and wherever that is, I'm ready to go. So you have to work at living, grasp every moment, do everything, be involved. They invite you to something, go to it. There's going to be goods and bads like everything else, but when you look at the big picture, it's a life worth living.
No, I
Yeah.
appreciate it. Thank you, and ask.
Yeah. Thank you again, Dr. Rodriguez, for taking the time. This has been such a special episode. Our last question for you is just, what's your favorite surgical instrument?
I think I'm going to have to go with a number 9 periosteo elevator. I could
Awesome.
I could peel off tissue. I could probably have a whole meal with
Yeah,
that.
that's what I was gonna
With
say.
with the broadside. I could cut a steak. I could, I would say, most people would choose a knife, and I thought it was a good question that you provided, but I think I would have to say the number 9 periosteo elevator. A lot can be done with that.
Yeah. And do
Awesome.
you listen to music in the operating room?
Always.
What do you listen to?
Well, initially I would pick the music. Now all my nursing staff, all my staff picks everything because if it were me, I'd always go to the 80s.
Yeah.
But most of my staff, they weren't even born then. So I let them play whatever they want. So anything goes. And
Yeah.
to me, nothing bothers me. I'm very relaxed in the operating room. I'm not patting myself on the back. What you see is what you get. I'm pretty focused and relaxed, and I want to feel good energy with how we're working. We certainly face some challenges, and there are some times to get focused, and people know it. But for the majority, it's kind of it's a good place to be, and we're comfortable. But we have a task to fulfill, and we want to make sure we do it in a timely manner.
Yeah. Well, you shared a lot of awesome lessons and life lessons, and I'm forever grateful of those. And to talk about how life passes, I look back to when you left Baltimore because you left a tremendous emptiness in everyone's hearts, and even myself, even though I didn't train under you, but everyone felt it, and can't believe that was what 2013, um,
Right.
which is, and it seems like 2 days ago
I
sometime.
know.
But thank you so, so much. I can't thank you enough.
Thank you.
This was so much to take home from, and the audience is really going to enjoy it. I really appreciate it.
Listen, my pleasure. Thanks for inviting me, and I hope it's helpful. And I wish you guys the best. And whatever I can do for you in the future, I'm here for you.
Thank you so
Thank
much.
you. Thank
You're
you.
welcome.
Take care.
Take care, guys.